Hey everyone, I'm Abbey Fernández and I'm here with Dr. Harsha Ramchandani, who is a Chief Medical Officer at Tri-City Health Center. Thank you so much for being with us today. So we brought in a health expert because we're talking about coronavirus left and right, and we're trying to see what the facts are and differentiate them from, from fears that people are having. So first of all, doctor, can we talk about what exactly is the novel coronavirus?
So WHO has given this term called novel coronavirus, which is like a new coronavirus. So I just wanted to mention a little bit, coronavirus is a large group of family, which usually causes a mild respiratory illness in humans. But this is a new type of coronavirus. And WHO has named the different terminology, and I know people are getting confused with this. You might hear COVID-19 and then SARS-2 and coronavirus. So you can imagine coronavirus is a large family of viruses. In that virus that is causing this particular respiratory illness and the disease, it's named as SARS-2, which is Severe Acute Respiratory Syndrome 2, because there was a first attack that happened in 2002 and 2003, and that was named as SARS. So this is a similar virus to SARS and named as SARS-2. And then what is COVID-19 is actually a short form for CO is for corona, V is for virus, D is for disease, and 19 is for 2019.
Gotcha.
So COVID-19 is basically a disease caused by this particular SARS-2 coronavirus, started in 2019.
Okay, talking about starting, where did this virus originate? I know that there's a lot of mixed confusion out there. People started saying it was from snakes, bats, and then people were saying it was man-made in a lab. I mean, there's just a lot of confusion. Where did this originate?
So again, going to the facts and from the website CDC, the information is that coronavirus, this particular SARS-2, is actually usually causes the disease in animals. So from animals to animals it spread. But unfortunately, the first case, which started in Wuhan, China, it came from an animal to human, and now it's spreading from human to human. And that's why it's something which is a new virus, and we don't have the treatment for that. So how did it start? It's really, we don't know yet, but it seems like it came from the animals.
Okay. And let's talk about the symptoms here, because, people are concerned. Obviously, we have a lot of cases in the Bay Area, and the numbers keep rising every single day. So people are concerned. What are the symptoms they should be looking out for?
So the symptoms are similar to the flu like infections, as I mentioned earlier. Also, this is a flu season going on right now. So patients will have similar symptoms. The most common symptoms is fever and cough. Those are the two common symptoms. Rarely people can have diarrhea. Some people, they also have upper respiratory infection symptoms like runny nose, chills, body ache, like viral symptoms. And clinically, if we see, and we have done one of the study which was published in New England Journal of Medicine, from one of the study of 1,009 patients, they found out one of the white cell count is lower in 80% of the patients on doing the testing.
Oh, interesting. Okay, and then when do we go to the doctor? I mean, let's say we are feeling those symptoms that you just talked about. We have fever, we have a cough, we may be sneezing. When do we go to the doctor?
So currently, we all know the cases are increasing. I mean, we are sitting in California Bay Area. We know all across the U.S. there are a lot of new cases. So our strategy at this time is to contain the disease.
Sure.
And we know there are 164 cases as per CDC and 11 deaths as of now in United States. So a lot of people, they recover on their own. That's the emphasis I want to give to our audience here, is that if it's a mild disease, it will recover on its own. So if the patients have symptoms of cough and fever or runny nose, please call your doctor line, because the protocols are that we are doing the phone triaging, we are educating the patients, we are advising them for the remedies that they can do, and asking the questions if they are sick enough to go to the hospital, or we have to do a testing on those patients. So we want the patients to stay home so that it doesn't spread to other people sitting in the waiting room or other sick people who are in the hospitals or clinics.
So what I'm understanding, the recommendation is just to call, don't go rushing to the doctor's office.
Exactly.
And see if it is a bigger situation than what we think.
That is correct. We are all equipped and in this age and days with the protocol like emailing your doctor office through My Chart, patient portal. There is nurses, there are doctors who are picking up the phones, and that's exactly what we have done in our clinic. So please call the doctor line, and they will advise you on the next steps.
Let's talk about the mortality rate, because I think, again, everyone's so fearful of catching this disease because we attribute it to death, right? And we hear all these deaths happening because of the disease. So who is exactly, dying from this disease, really?
Actually, we are learning about this novel coronavirus. This is something new. There's no vaccination for this. CDC and WHO, they're all working on this. But so far, what we have learned is people, senior, old age patients with the comorbid conditions, they're at a high risk of the mortality.
Okay.
And it's very uncommon in kids as of now, which is a fortunate thing. So the death rate is more common in the elderly population with the comorbid conditions, but the young people more than 15 years of age are also contracting the disease. So if they have the disease, although it's not that severe, but they can still transmit it to the other people. It's a communicable disease. So we want to make sure anybody who is sick, they should contain the disease, they should stay home, quarantine themselves if there's an exposure, and then call the doctors for the next steps.
For the older folks, the elderly, what are the conditions that might affect this more or put them at a higher risk?
So it's a respiratory condition. So because ultimately if it causes a pneumonia, that's the main cause of the death in patients. So anybody who has a long-standing history of smoking, anybody with emphysema in the lungs, anybody with the lung conditions and diabetes because it decreases the immunity, anybody who is on immunosuppressants, the medication that reduces the immunity, they're at a higher risk.
Okay. And then I want to ask, prevention. What do we do? What can we do to protect ourselves, and what can we do to protect others around us?
That's a great thing. We should be protecting ourselves and our family. So the steps are listed on the CDC websites as well as on your. Please go to your doctor's website. But the main thing that I want to mention is washing hands is the key. Washing hands for 20 seconds at least, and that helps to prevent. Also using the sanitizers, wiping the surfaces, it reduces the spread. And if you know anybody who is having symptoms, staying away from them. We're asking the employees also to stay home if they are sick. And the doctor's note is no longer required in most of the companies. If they are sick, stay home. That's the best.
So people are concerned about shaking hands. People are concerned about taking in cash. Should they be concerned to shake someone's hand or take someone's cash?
So if somebody is not symptomatic, like if they're not coughing and sneezing and they don't have fever, most likely they don't have any symptoms or any infection, and they're not going to transfer the disease. But it's always, at this time, we're all learning, as I mentioned, and we want to contain the disease as much as possible. It's better to use the sanitizers after shaking hands or just stay away from a distance.
Got you. Lastly here, doctor, what would you tell the folks out there, especially, our residents here in the Bay Area that are seeing a lot of these, situations happen right next to them? What do you tell them?
I want to mention definitely that please do not panic. We have to all come together here to contain this disease. Again, wash hands, advise your kids and your all family members. They should be washing hands, sanitizing the surfaces, and if they have cough or cold, wear the mask. So mask is not recommended at this time by CDC for every single person, but if you have any symptoms of cough, sneezing, runny nose, please wear mask.
Lastly here, I said earlier that it was lastly, but you reminded me of something. Home remedies, they're really big. I keep seeing that on Twitter. I keep seeing it online. People saying that if you take, vitamin C or, you eat a lot of garlic, stuff like that would help. Does that have any truth to it?
Definitely we do recommend if you have a viral like illness, taking Tylenol. That helps to reduce the fever. Any cough syrup, you can take it. Overall, I'm going to say we're learning as, this thing is emerging, but we do know that it causes symptoms like flu. So in the flu, we do recommend taking vitamin C to boost your immunity and multivitamin. So it's no harm in taking the multivitamin at this time.
Okay. All right. Well, thank you so much, doctor, for all this insight. And if you guys want to learn more about this coronavirus outbreak, you can go to our website, NBCBayArea.com/coronavirus. We have a lot of coverage there about everything that's happening locally, nationally, and internationally. Again, thank you so much, doctor.
Thank you for having me.
Bye, guys. We'll see you later.